As a lot of people right now are wrapping up their holiday travel, getting back to where they belong. A lot of people are getting sick after their holiday travel. And that's what we're going to be discussing right now. New reporting coming over from Reuters shows that flu cases are rising across the country, and the public health experts are actually saying that people are pointing to holiday travel and indoor gatherings as major drivers. Even the CDC is also warning travelers to watch for symptoms in the days after returning home, something important to look out for. That's why I wanted to bring on our next guest, Dr. Peter Ching Hong, an infectious disease expert at UCSF, to help explain why people get sick after traveling. So, as I just said before, with Reuters actually reporting this, the flu cases are climbing nationwide. I wonder why so many people are fine traveling, and as soon as they get home, that's when the flu bug comes out.
Well, Jay, I think about two things. We always focus on the environmental issues, but I'll talk about the personal and individual issues too. So from the environmental perspective, travel brings together a lot of noses and mouths together, which can spread respiratory viruses. A lot of indoor settings, they may not be great ventilation, particularly when you're lining up on the plane, you're on a crowded train, it's cold outside. But there are also individual or personal factors as well. So people don't have enough sleep, they don't eat well, their immune system is sluggish, their microbiome changes. So all of that really leads to increased susceptibility of infection apart from the environmental factors.
Yeah, I definitely could see that there as well. And when doctors talk about the incubation periods, what does that actually mean for someone who flew, went to parties, or spent time, like you said, in indoor spaces there as well?
So there's usually a lag or a delay between when you're exposed and when you get symptoms. And that is generally in the order of 3 days. So you come home from traveling across the country to see grandma, or from that New Year's celebration where you might have been indoors with a lot of people. You wouldn't get sick immediately. You might get sick 3 days later. So it's important to think about that. There's some viruses and infections that might be a little bit faster, and those include influenza that you spoke about, Jay. You might get as sick as 1 day after. And then, of course, with COVID, because our immune system has seen COVID so many times in this country, you might get symptoms a little bit faster than when your test might turn positive. So in general, about 1 to 3 days, on the average 3 days.
That's the first thing I get home is I pump the medication like crazy. The airborne, the emergency. I just feel like it's coming on. I'm on airplanes a lot, and I really feel like the bigger risk is not really the flight itself or what happens before or after, but just being inside like the airport, as well as we're seeing some video of that. What would you suggest for people to do in terms, I know hand sanitizing, maybe washing your hands and stuff as well?
Well, that, Jay, is probably the most important factor that people don't think about, because it sounds really boring, right? Keeping your hands clean. But even in the hospital, certainly when you're traveling, that is the number one thing you can do. And probably even better than hand sanitizer if you can, wash your hands with soap and water, because some things like norovirus, which causes what we call the stomach flu or winter vomiting virus, can only be best prevented by washing hands with soap and water. However, hand sanitizer can get rid of a lot of other things like colds and COVID and flu. When you touch surfaces and you touch your nose or your mouth, that's a really efficient way of spreading it, particularly in the airport or airline seat where a lot of people have touched that same surface before.
Something else that kind of stands out at me as well. The CDC has been warning travelers to pay attention to their post-travel symptoms. What's the biggest mistake you see people making when they start feeling sick and then they start heading back to their home?
I think one of the biggest mistakes is really amounts to people who are vulnerable. So the very young, so parents of very young kids or very old people, they kind of dismiss these symptoms as being no big deal. But symptoms might start off very slowly, particularly for those on the extreme of ages. For example, flu. And if you get that diagnosis early on, it helps with a lot of things. You can protect people in the household if you have somebody who you're worried about, or if you are worried about yourself and you're somebody who's vulnerable. that early test for flu or COVID, for example, can help you decide if you need to take antivirals, which can then prevent, say, a trip to the emergency department or hospitalization even.
I'm sure this next question could really help a lot of people out. For people watching who just traveled or they're heading back to work this week, what's one thing that they should watch out for over the next several days that tells them they need to slow down and maybe just get checked out just to be safe?
Well, I think some of the red flags that I'm worried about are things. Fever always makes everyone nervous because it suggests that the infection is more than just in one area. Say, like a cold doesn't really cause you to get fevers, but something like flu, because it travels all over the body, can result in those systemic symptoms. The second thing, of course, is shortness of breath. Somebody who's short of breath, say you don't normally have any problems going up that flight of stairs at home, all of a sudden you're puffing, that might mean you have a pneumonia, and that indicates that shortness of breath may get worse. So again, nipping it in the bud early on might be helpful. And for very young and very old people, seeing grandma or grandpa be a little bit more sluggish, going to the bathroom less often, might mean that they're more dehydrated, and that could lead to more problems than the infection itself, particularly if they have heart disease, kidney disease, etc. And then very young, same thing as well. It takes not that much for babies to get very dehydrated, and all of a sudden they are sleepier, they're not feeding as well, their diapers are not wet, they're not producing wet diapers. Those might be clues for people to look out for.
Really good tips there. Thank you so much, Dr. Peter Ching Hong from UCSF, coming on, helping people out after holiday travel. Thank you so much for coming on the show.
Happy New Year, Jay. Thank you.
Happy New Year's to you as well. All right, everybody. Wanted to give you a couple of tips on what to look out for so we can stay safe after the holiday season is going on. So also, too, it feels like everyone around you is getting sick right now. You're probably not imagining it. Fox 7 Austin reports flu cases are rising, and health officials say the cases are expected to continue going up following Christmas travel and indoor gatherings. Steve Harrigan has more with this Health Beat report. Let's go ahead and listen in.
Across the country are scrambling to contain a new surge of respiratory illnesses. And while COVID and RSV are on the radar, this year a new variant nicknamed Superflu is causing the most infections.
It just so happens that this subclade K variant that we're seeing really does seem to spread very efficiently. It's just part of its genetic makeup.
You can see here on the CDC's latest flu tracker, most of the country is experiencing high activity. So far this season, we've seen at least 7.5 million cases, 81,000 hospitalizations, and more than 3,000 deaths. Experts say the virus is affecting children more severely.
That's what we've seen in other countries where it's those less than 24 years of age have had really very high rates of hospitalization and ICU admission.
And that trend is expected to continue as people return from holiday travel.
If you go to the urgent care clinics or doctor's offices or even emergency rooms, they're flooded now with a lot of flu patients.
Another big driver, vaccine hesitancy. Only 42% of adults have gotten the flu shot this year. Doctors say while the new variant is not a perfect match for the vaccine, recent analysis from the UK finds the shot offers at least partial protection.
It's never too late to get a vaccine, and really this is the best protection that we can offer at the moment.
The CDC says hand washing can minimize the spread. In Atlanta, Steve Harrigan, Fox News.
Thank you, Steve, for that story there, keeping people safe during this holiday season.